The goal is to never need oral steroids or steroids for an emergency purpose. If you are receiving steroids more than twice a year, then that is a red flag that we need to do a better job in fixing or taking our medications, if that's the inhaled steroid or increasing the dose or adding another inhaler. But that is usually a point where we know that we need to do a better job so that we're not taking oral steroids in an emergency.
So just to be clear, the only time that you ever want to take oral steroids is if you end up in the ER and it's just looking like it's completely out of control and we can't get you out of that inflamed state.
That's typically the scenario where a patient's been taking their inhaled steroids, and like Dr. Gupta mentioned, there's a trigger or some reason they're flaring and those inhalers aren't working at that moment. So typically patients will go to the emergency room or they'll go to urgent care and they'll get a prescription for the oral steroids to help them through that flare. That's typically how it goes.
And I think one other thing that I always mention whenever we talk about asthma is the overuse of the urgent cares and emergency rooms as a point of care for asthma patients. We see that a lot, that sometimes asthma patients don't have a good asthma doctor that they're following up with and keeping in touch with. And so they end up going to the urgent care or emergency room. And again, those doctors are great doctors, but they are not trained in other treatments that are available for asthma. So they will more than likely give oral corticosteroids, but they won't give an inhaled corticosteroid or definitely not a biologic as a prescription to control the inflammation. So even if you've been to the ER 2 or 3 times within 2 to 3 months, the emergency room doctor may say, hey, something's not right and you need to be seen by a specialist.